Assalamualaikum warahmatullahi ta'ala wabarakatuh. I'm Kuraima Ijasani and today I'm going to report about the post-operative nursing management. So there are 7 learning objectives in this topic, but I'm going to concentrate about the first learning objective, which is to describe the responsibilities of the post-anesthesia care unit nurse in the prevention of immediate post-operative complications. The PACU nurse care for patients who are waking up from anesthesia. They primarily work in the post-anesthesia care unit of hospitals. These nurses monitor a patient's vital signs, check their level of consciousness, and look for any side effects from anesthesia. They work with a wide variety of patients and often with 1 or 2 patients at a time. PACU nurses work in a fast-paced environment and need to work quickly. Additionally, PACU nurses must coordinate with the patient and family members on post-op care and advise them on medications to take and when to take them. Specific responsibilities for PACU nurses involve monitoring post-operative patients' state of recovery and consciousness from anesthesia and giving updates to the treatment team, checking vital signs to catch any malfunctions and provide an easy recovery. Keeping dressings, bandages, etc. clean, dry, and safe. Treating pain, nausea, and other post-operative symptoms of anesthesia and administering medication as prescribed. Communicating with patients and family members on the post-operative care procedures and how to continue care upon discharge, and updating charts, patient files, and medical records.
Hi guys, I'm Fatima Mikala Karil P. Jalas from BSN 3 Capricorn. For this video, I'm going to tackle about the second objective of post-operative care, wherein this objective will let the learners know how to compare the post-operative care given to ambulatory surgery patient and the hospitalized surgery patient. So, before we start, we need to know what does post-operative care mean. Post-operative care is the care given to a patient after a surgical procedure. So, the type of post-operative care we receive depends on what surgery we had, or it depends on our health history. So, it often includes the pain management or even wound care. So, probably, post-operative care is immediately given to a patient every after the surgery. Next, let's compare the two. Ambulatory surgery patient. Ambulatory surgery patient is also known as the same-day patient or the outpatient. It occurs when the patient is expected to go home same day as the surgery. But what ambulatory patient typically means is the ability to walk. The word ambulatory means the ability to walk. But in the concept of surgery, it refers to the patient who are able to leave the hospital the same day as the surgery. That's what ambulatory surgery patient means. Ambulatory surgery patient or the outpatient surgery eliminates the inpatient hospital admission. It reduces the amount of medication prescribed and uses a doctor's time more efficiently. There are some types or common types of ambulatory patient or ambulatory surgery patient or the outpatient. There are arthroscopy, breast biopsy, cataract, cataract surgery, circumcision, and etc. According to research, outpatient surgery might be developed in some circumstances, and that reasons include improved surgical instrument, less invasive surgical techniques, and the desire to reduce healthcare costs. What happens after the outpatient surgery? So, for outpatient surgery or the surgical, the ambulatory surgery patient, after the surgery, the nurses or the medical field would bring the individual into the minimal, would bring will bring the individual or the patient to the recovery room, or known as the PACU, the post anesthesia care unit. Next, after the surgery, probably the patient would ideally wake up with minimal pain. So that's the reason why they can leave the hospital after their surgery. But we can only let the patient go home after the surgery if that patient meets the following criteria. First, the patient would have stable vital signs. Next, they can already tolerate food and drinks. Next is they could be able to empty their bladder to eliminate urine. And lastly, they can already walk without assist. So we also have side effects after the surgery of ambulatory surgery patient or the outpatient. That include nausea, vomiting, sore throat, and discomfort at the surgical site. That's all for ambulatory surgery patient. Next is the hospital surgery patient. So when we say hospital surgery patient, we also know this as the inpatient. A form of medical care that requires a minimum of one overnight at a hospital, prescribed by physician until an official discharge from the facility is permitted. So the hospitalized patient is the vice versa of ambulatory surgery patient. If ambulatory surgery patient can go home after the surgery, hospitalized patient needs to be observed after the surgery. So they are needed to be admitted at the hospital after their surgery. There are some common inpatient surgeries, and that includes cesarean section, diagnostic ultrasound procedure, endoscopy of small intestine, and cardiac catheterization, and many more. Hospitalized surgery patient tends to be directed toward more serious ailments and trauma after the surgery, or before the surgery. The caregiver or the care provider know that the surgery that is given to them or provided to them will need to be have the postoperative care of hospitalized surgery. Next is hospitalized surgery patient will receive permanent postoperative care. That's what I am saying a while ago. and their recovery will be carefully monitored. So after the surgery, they are still be monitored by the assigned nurse for them. The procedure that entails a prolonged recovery period. So that's some idea about the hospitalized surgery patient. To know what is the difference about the ambulatory surgery patient and this inpatient. Next is the question, what happens after the inpatient surgery? First, just like the ambulatory surgery, they are taken to a recovery room or the PACU, the post-anesthetic recovery care room. Next, they are checked often by the nurse assigned to them. So that nurse will probably check the vital signs of the patient, monitor their urine, like that. Next is after the surgery, the patient will commonly feel cold and chilly after surgery. So if that patient will feel that some side effect of surgery, don't hesitate to let your nurse know. Lastly is in some cases those hospitalized patient, they are tend to get or to have a temporary catheter in place after their surgery. So that's all for hospitalized patient. I hope now that you have learned about what is ambulatory surgery patient and what is hospitalized hospitalized surgery patient. Next, this would be the overall summary of the difference or how you compare the ambulatory surgery patient and the hospitalized surgery patient, or known as outpatient and the inpatient. Next, that's all for my report. Next, let's hear from the next reporter. Thank you for listening.
So, Assalamualaikum. So, today I will talk about post-operative complications that are common and their management. So, what is post-operative care? So, this is the care that you receive after a surgical procedure. The type of post-operative care you need depends on the type of surgery you had, as well as your health history. It often includes pain management and wound care. So, post-operative care begins immediately after surgery, and it lasts for the duration of your hospital stay and may continue after you've been discharged. So, as part of your post-operative care, your health provider should teach you about the potential side effects and complications of your procedure. The common post-operative complications may include kidney failure, post-operative gastrointestinal complications, anemia, post-operative fever, and delirium. So let's talk about renal or kidney failure. So kidney failure is a serious and relatively common post-operative complications with incidence ranging from 18% to 47%. 47% of surgical cases. Immediate complications associated with kidney failure or renal failure includes development of sepsis, anemia, coagulopathy, and need of mechanical ventilation. So, what is the cause of kidney or renal failure? So, the most common cause of postoperative renal failure or AKI or acute kidney injury is renal hypoperfusion as a result of transient hypotensions and hypovolemia. The clinical management for kidney failure or renal failure, the management strategy to prevent kidney failure focus on optimizing volume status, renal perfusion, oxygen delivery, and avoidance of nephrotoxins. So let's go to postoperative gastrointestinal complications. So it is also known as the postoperative nausea and vomiting or PONV. It is also defined as the presence of nausea, vomiting, or retching that occurs in the post-anesthesia care unit to within 24 hours post-operatively. The incidence of PONV ranges from 30% up to 80% and has been shown to be more dreaded by patients than post-operative pain. So the management for this is that the most widely used and most effective medication option for SUP include proton pump inhibitors or PPIs and histamine 2 receptor blockers or H2B. Other less effective and less used options include sucralfate, a cytoprotective agent, and prostanoids such as bisoprolol, which decrease gastric acid and bolster mucosal defense. Antacids are no longer recommended for SUP given numerous complications including electrolyte derangement, hypermagnesemia, hypercalcemia, and hypophosphatemia, and evidence for increased gastrointestinal bleeding. Clinicians should also be aware that the most commonly used SUP agent, PPIs, and H2B are not free of potential adverse effects. There is robust evidence supporting the increased risk for nosocomial pneumonia, Clostridium difficile infections, hypomagnesemia, and bone health complications. For the third, anemia or post-operative anemia. Anemia is another common complication in the post-operative settings, occurring in up to 80% to 90% of individuals undergoing major surgery. The safety and feasibility of preoperative intravenous iron therapy makes this the best approach to mitigating perioperative anemia when feasible. the third common complication, we have anemia or postoperative anemia. So, postoperative anemia is another common complication in the postoperative setting, occurring in up to 80% to 90% of individuals undergoing major surgery. The safety and feasibility of preoperative intravenous iron therapy makes this the best approach to mitigating perioperative anemia when feasible. Intravenous iron therapy is effective at increasing preoperative hemoglobin levels and can effectively decrease transfusion in non-cardiac surgery patients. Iron deficiency anemia is common in the postoperative settings with adherence to restrictive transfusion strategies. Patients often do not have iron stores to replenish intraoperative blood loss. So the management for postoperative anemia, we have managing anemia. The postoperative setting must be individualized. Given the safety and efficiency, it would be reasonable to give intravenous iron therapy to patients in the postoperative settings with mild to moderate anemia and postoperative iron deficiency. Transfusion outside of guidelines should be reserved for those who have hypotension and tachycardia, not responding to fluids, or otherwise hemodynamically unstable, like symptomatic anemia. Those with ongoing blood loss or those with comorbidities necessitating a lower hemoglobin threshold. The fourth common complications is fever or postoperative fever. This is defined as a temperature over 30 Celsius and very common finding. The pathophysiology over fever is related to a release of cytokines in the body. These cytokines may be related to the inherent stress of surgery or due to more sinister causes such as infections. Although postoperative fever is frequent benign, its presence cannot be ignored. One of the most useful frameworks for thinking about postoperative fever is to consider the timing of the fever and relation to the surgery. So for its management, the treatment can be include oxygen, fluid balance, intravenous fluid, and urinary catheter or antibiotics. So for the drugs, we have antibiotics, analgesia, or antiemetics. And then incentive spirometry, venous thromboembolism prophylaxis, low molecular weight heparin, and wearing automatic stocking, and escalation. Repay information to a senior health um, repay information to a senior health um, professional and ask for further advice from the infectious disease physician. So the last post-operative complication is the delirium. So the delirium is a complex medical syndrome consisting of disturbance in attention and cognition not directly caused by another neurocognitive disorder or medical condition and developing over the short period such as hours to days. Delirium is a common surgical patient. The delirium is common in surgical patients, with some studies noting a prevalence of 62% in elderly surgical patients. However, similar to most aspects of perioperative medicine, higher risk surgeries as well as patients' risk factors influence the likelihood and developing delirium. So for the treatment of this complication is that management of delirium focuses on identifying reversible cause and emphasizing reorientation in stable environment with consistency of staff and location, non-pharmaco. So for the treatment of delirium. So for the treatment of the delirium, management of delirium focuses on identifying reversible cause and emphasizing reorientation in a stable environment with consistency of staff and location, non-pharmacologic strategies, and addressing modifiable risk should be the cornerstone of delirium management. Melatonin supplementation may play a role in prevention of perioperative delirium, and given its limited side effect profile, is a reasonable option for patients at risk for delirium.
Describe the gerontologic consideration related to postoperative management. Gerontology is the study of aging. Gerontologists study the biological, psychological, and social dimension of aging. Social gerontologists focus on social aging and distinguish several dimensions of aging, which refers to change in people's rules and relationships as they age. So, ang gerontology ay ang pag-aaral ng mga pisikal na aspeto ng pagtanda, pati na rin ang kaisipan, panlipunan at panlipunang implikasyon ng pagtanda. Postoperative care is the care you receive after surgery procedure. The type of postoperative care you need depends on the type of surgery you have, as well as your health history. If often include pain management and wound care, postoperative care begins immediately after surgery. Ang pangangalaga ng postoperative ay naglalayong matugunan ang pisikal at pang-psychological na pangangailangan ng pasyente ng direkta pagkatapos ng operasyon. Kapag nagbibigay ka ng pangangalaga pagkatapos ng operasyon sa mga matatandang pasyente, dapat maging maingat ka dahil ang pisikalidad ng pasyente ay napakarupok, hindi katulad ng mas batang mga pasyente. Ang proseso ng paggaling, ang kanilang katawan ay nasa isang mabilis na estado, hindi katulad ng mga matatandang pasyente.
So good day, sir. So my topic for today is all about the described variables that affect wound healing. So when we say wound healing, it's as a normal biological process in the human body and achievements through the 4 processes and healing program phases. We have the hematitis, inflammations, polyteralations, and remodeling. For the wound to heal successfully, is all 4 phases must occur in the proper sequence at a time frame. So ongoing assessment of the surgical sites involves infections for the approximate of wound edges, integrity of structures on of structures, stiffness, redness, discoloration, warm, swelling, unusual tenderness or drainage must check by the nurses. So we have 3 types of wound drains include the Penrose, Hemovac, and the Jackson-Pratt drains. So the Penrose drain is a soft, flat, flexible tube made of letter inlet blood and other fluids move out of the area of your surgery. So to use this is a superficial wound where there is a pre-existing or the artificial fluid program. And next is we have the Hemovac drains. Hemovac drains, you suddenly stop draining fluid or think your drains is blocked. So a use is to drain, remove any blood or damp fluid that might build up in the area. So we have next is we have the Jackson-Pratt drains. A Jackson-Pratt drain is a closed suction medical device that is commonly used as a post-separating drain for the collecting bodily fluid from surgical site. So the use is to help empty excess fluid from the body after the surgery. So earlier I mentioned the inflammatory, the polylateral and the remodeling. So the inflammatory also called inflammatory also called log or executive phases. So the duration of wound healing is 1 to 4 days. And then we have the proliterations, also called the fibroelastic or the connective tissue phases, and the duration of the type of day is 5 to 20 days. And then last is the moderation phase, also called the differentiations, resorptive remodeling, or the plateau phases. So the duration is 21 days, 2 months, or even years. And next is we have the intention of wound healing. So first intention healing term primary healing is the healing that occurs when the clean lacerations or surgical close primary with a suture. So next is we have the second intention healing. So it's a term of secondary healing. Secondary healing that occurs when a wound is left open by heal the grammatations, construction, and the epithelializations. So we have the third intention healing or tertiary intentions, also called the delayed secondary closure, occurs when there is a need to delay closure a wound, such as when there are poor circulations of wound area or the infection. So that's all for my topic. Thank you.
Wound care dressing change with irrigation and packing. Before beginning this procedure, always perform the following steps to ensure patient safety. Perform hand hygiene. Provide patient privacy. Introduce yourself. Use 2 patient identifiers. Verify allergy status. Perform environmental safety check. Ensure proper body mechanics. Gather all supplies. Provide patient education. Assess the patient's condition, including the dressing and wound, as well as the pain level. If needed, medicate with analgesic 30 minutes before procedure if medication is to be given PO or IV. Explain the procedure to patient. Materials needed for dressing change. Gloves, biohazard bag, irrigation tray with bulb syringe, normal saline irrigation bottle, dressing change tray, measuring device, sterile cotton swabs, 4x4 gauze pads, tape, sterile gauze pack, sterile gloves. The procedure. Position patient. Apply clean gloves. Remove the old dressing, including packing, and assess the old dressing, noting color, odor, consistency, and amount of drainage. COCA. Dispose of old dressing in biohazard bag. Assess the wound edges and wound bed. Note any presence of infection, checking for healthy granulated tissue, exudates, slough, eschar, indurations, swelling, etc. Measure length, width, and depth using wound measuring tools and a sterile cotton swab. Dispose of soiled supplies in biohazard bag. Set up irrigation supplies. Irrigate wound using gauze pads to catch solution and debris. Remember to irrigate in one direction until solution runs clear. Pat wound bed with sterile gauze pads as needed. Discard gauze pads in biohazard bag. Wash hands per CDC guidelines. Prepare sterile dressing change tray and dressing supplies using sterile technique. Do not cross or turn one's back to the sterile field throughout the procedure. Don sterile gloves, maintaining sterile technique throughout the procedure. Repack wound with sterile packing using sterile technique. Be careful not to touch the edges with the sterile gauze. Remember not to cross the sterile field when disposing items in the appropriate receptacle. Apply sterile top dressing. Secure dressing appropriately. Label dressing with date, time, and initials. Ensure safe environment. Return bed to lowest height with brakes locked and appropriate side rails up and call light and bell in reach. Dispose of soiled supplies in biohazard bag. Wash hands per CDC guidelines.
Wound dressing protect wound from the environment and also protect wound from soiling with body fluids or waste. And also, the important and clinical significance of wound dressing should provide most optimum conditions or wound healing while protecting the wound from infection with microorganism and trauma. It is important to provide a dressing to remove automatically and also to provide further damage to the wound and surface of the dressing change. The purpose of post-operative wound dressing is a traditional to cover the wound with dressing and also act as physical barrier to protect the wound from contamination. Dressing can also serve as to absorb exudate from the wound and keep it dry. Dressing is important component of post-operative wound management. A good dressing should maintain a moist wound environment and promote wound healing. Be able to remove excessive and exudate that might lead to macerations of the wound. Dressing is also applied during surgery and have been done with sterile conditions or as a
For the nurses assessing the patients is very important while in a PECU or post-anesthesia care unit. So, the following are the assessing that is done by the nurse to make sure the patient's safety, well-being. First, to assess frequently the blood oxygen saturated level, pulse rate, and frequently a measure of respiratory skin color, level of consciousness, inability to respond to command are the cornerstone of nursing care in the PECU. So the said assessment are very important in PECU to prevent future complication of the patient. The nurse perform a baseline assess, then check the surgical site for drainage or hemorrhage and make sure that all drainage tube and monitoring line are connected and functioning. The nurse check any IV fluid or medication currently infusing and verify dosage and rate. The importance of performing a baseline assessment for the nurses to determine the progress of the patients and condition while in the PECU, ensuring also that all equipments attached to the patients are properly intact. After the initial assessment of the patient's vital signs and general physical status are assessed at least every 15 minutes. This is to determine any change in the patient's condition and the progress of the vital sign. In the PECU, assessing the patency of the airway and respiratory function are always evaluated first, followed by assessing of cardiovascular function, the condition of the central nervous system. The nurse must be aware of the history of patient that may be significant